Good evening and welcome everyone. Thanks for joining William Osler Health System tonight for our telephone town hall. My name is Salim Chattergoon and I'm Osler's Director of Integrated Health Systems, and I'll be your moderator this evening. My role at Osler over the past couple of years has focused on working with community health partners to bring a more coordinated system of local health care to this region. I'm very pleased to be helping with the telephone town hall tonight. As your community hospital, we're here tonight to bring you the latest about Osler's ongoing COVID-19 response, provide updates about our programs and services, and share news about our hospital redevelopment plans that will expand access to care for you and your family. But our main objective tonight is to hear from you. We're looking forward to taking your questions and hearing your comments, and over the next hour, we'll also ask you a few polling questions that you can respond to easily on your phone. A number of Osler leaders are here to speak with you tonight and to answer your questions. These leaders are Dr. Naveed Mohammed, our President and Chief Executive Officer, Kiki Ferrari, our Chief Operating Officer, Dr. Frank Martino, our Interim Vice President of Medical Affairs, Research and Academics, Ann Ford, our Executive Vice President of Strategy and Corporate Services, and Mary Jane McNally, our Chief Patient Experience Officer. We're also pleased that Dr. Lawrence Lowe, the Medical Officer of Health for the Peel region and a great partner of Osler's, is joining us tonight to answer any questions that you may have with a public health focus. We're expecting that Dr. Lowe will join us shortly. And over the next hour, there will be a number of opportunities to ask questions. To be placed in the queue to ask a question, please dial *3 on your phone at any time. We'll get to as many questions as we can this evening, and for those callers that we cannot get to, we will make sure that you receive a follow-up response. For those of you who are just joining us, welcome to William Osler Health System's Telephone Town Hall. I'm now going to pass it over to Dr. Naveed Mohammed, Osler's President and CEO, to begin our discussion.
Thank you, Salim, and good evening, everyone. I hope you and your families are keeping well and staying healthy. As the COVID-19 pandemic continues, it is more important than ever that we stay connected. So we appreciate you spending this time with us tonight. To introduce myself, I began my career with Osler in 1997 as an emergency medicine physician at Etobicoke General Hospital. I have progressed through a number of leadership roles, and in April of this year, I became the President and CEO. I am honored to lead Osler during this time. Osler's vision is an unwavering commitment to patient-inspired healthcare without boundaries. As CEO, my vision for Osler works in parallel to take us further along our journey as a leading hospital system and to ensure we live up to our mission to deliver innovative healthcare delivered with compassion to those we serve. As we look back on 2020, it has been an incredibly challenging year for many of us. At the same time, it has been uplifting to see how our community, patients, families, staff, physicians, and volunteers have come together like never before. Over the past year, we have been humbled by your support for our healthcare heroes, the hospital staff and physicians who have answered the call when the community needed the most. The acts of kindness and generosity by over 5,000 donors have helped fund the equipment within our hospitals and have truly inspired our teams and kept them going. Thank you for this support. A little over a month ago, we were pleased to receive Ontario government approval for 87 additional beds across Brampton Civic Hospital and Etobicoke General Hospital. These new beds will help to ensure we have greater capacity and prevent hallway medicine challenges. Looking ahead to 2021, Osler will continue to provide safe, quality care as we manage through the pandemic. I'm excited about growing our research and innovation initiatives, and I look forward to continued work with the community and community health partners to advance the Brampton, Etobicoke, Ontario health team. We will also advance the next stages of our hospital redevelopment and expansion plans. You will hear more about these later this evening. Over the next year, we will keep you updated on our progress. A hospital is a place that brings people together, and it is an honor to serve this community. Thank you again for participating tonight. I will now pass it back to Salim.
Thank you very much, Dr. Mohammed. And for those of you who have just joined us, if you'd like to ask a question or to make a comment, please press *3 on your phone at any time. This will bring you into the question queue to speak with one of Osler's leaders, and we kindly ask that you keep your question brief so that we can get to as many as possible tonight. I would now like to ask Kiki Ferrari, Osler's Chief Operating Officer, to share some updates. Kiki?
Thank you, Salim. Good evening, everyone. I will briefly share a few important updates about Osler's COVID-19 response. Since the pandemic began in March, Osler's teams have continuously adapted to respond to the community's health needs. After setting up one of the first COVID-19 testing centers in Ontario, we have led the province with close to 300,000 COVID-19 tests. Our two drive-through COVID-19 testing centers in Brampton and Etobicoke remain open by appointment. However, to keep patients and staff safe and comfortable during the winter months, we will be moving our two testing centers indoors next week. Our Etobicoke Testing Center, which is currently located in the Humber College overflow parking lot of Queens Place Drive, will test its last drive-through patients on December 7th and will reopen at Etobicoke General Hospital the next day, December 8th. The Brampton Testing Center's last day at South Fletcher's Sportsplex will be December 9th, and it will reopen the next day, December 10th, at Osler's Peel Memorial site. More information about these moves will be available across our channels. The COVID-19 cold and flu clinic at Peel Memorial, another first in the province, is open daily. No appointment is necessary. Osler is also working closely with our Brampton, Etobicoke, Ontario health team partners, which include many community health providers, to help ensure there is more COVID-19 testing in the community. These efforts are focusing specifically on bringing more testing to areas of Brampton and North Etobicoke where there's a higher prevalence of COVID-19 and people are at a greater risk of contracting the virus. Over the past month, Osler has seen an increase in the number of COVID-19 patients seeking care at our hospitals. Currently, there are 72 COVID-19 patients at Osler's hospitals, and 17 of those patients are receiving care in the intensive care unit. We continuously work to adapt to the dynamic situation. Beginning recently, we temporarily postponed some non-urgent surgeries and procedures due to COVID-19 related capacity pressures. Patients are being notified directly if their surgery is being postponed, and we will reschedule these as soon as we are able to safely do so. A number of our services are now being offered through virtual care, meaning that when appropriate, our physicians and clinicians can provide care to patients online. In addition to being a convenient option for patients, virtual care reduces the number of people coming into the hospital, which helps to protect the safety of our patients as well as our staff, physicians, and volunteers. We know that for patients, the importance of a visit from family and friends promotes a positive healing environment. To keep everyone safe, and as many other hospitals in the region have done, we have had to take the challenging step to implement a no-visitor policy due to the presence of COVID-19 in the community, with some limited exceptions. We do have virtual visitation options and are reevaluating our visitor policy every week as the current situation continues to evolve. Finally, please know that our teams continue to work tirelessly to ensure we continue to provide care to those who need it. If you need care, please do not hesitate to come to the hospital, and we will take care of you. Thank you, and I wish everyone a safe and healthy holiday season over the coming weeks.
Thank you very much, Kiki. And to everybody on the line, over the course of the call, we'll be asking you some questions to help gather your input on a number of topics. We would now like to ask our first polling question. To answer the question, please press the number on your phone that corresponds with your answer. Our first question is, what is your primary interest for joining tonight's telephone town hall? Please press 1 if your answer is, I want to stay up to date on hospital services. Press 2 if your answer is, I have a specific question or concern I want to ask. Press 3 if your answer is, I am listening to hear about Osler's COVID-19 response. And press 4 if your answer is, you are joining for another reason. I'll repeat the question and response choices one more time. So the question is, What is your primary interest for joining tonight's telephone town hall? Press 1 if your answer is, I want to stay up to date on hospital services. Press 2 if your answer is, I have a specific question or concern I want to ask. Press 3 if your answer is, I'm listening to hear about Osler's COVID-19 response. And press 4 if you are joining for another reason. Please enter your responses on your phone now, and we will share the results shortly. Next, I would like to introduce Dr. Frank Martino, the Interim Vice President of Medical Affairs, Research and Academics, as well as Mary Jane McNally, Osler's Chief Patient Experience Officer, to say a few words before we begin to take your questions.
Thank you, Salim, and good evening, everyone. My name is Dr. Frank Martino, and I've been practicing family medicine in Brampton for many years, and I've held a number of leadership positions at Osler. Tonight, I'm here to share a primary care and community health perspective as part of the discussion, and I'll help answer your questions from a physician's perspective. Looking ahead to the holidays, I want to mention the importance of planning ahead for your care. I would encourage you to check with your physician's office to ask if they are open over the holidays or whether they will offer virtual care with appointments online or by phone. I would also encourage you to ensure any prescriptions you or your family members will need are filled and to ensure you have the medication you need over the holidays. Ensure your physician has on file the pharmacy that dispenses your medication. And if you have elderly parents, I encourage you also to assure that they have a sufficient quantity of medication over the holidays. You may also want to familiarize yourself with community walk-in clinic locations or urgent care clinics in your neighborhood. I look forward to answering any of your questions this evening. Thank you, and I'm going to hand things over to Mary Jane McNally.
Thank you, Frank. Hello, everyone. My name is Mary Jane McNally, and I'm Osler's Chief Patient Experience Officer. As patients, family members, and the community, your experience is at the heart of everything we do as a hospital. Our Patient Experience Office is here to support patients and families with a range of issues, from suggestions to concerns and complaints, and of course, compliments. You can reach us in person at any of our sites by phone or email or through our website. We also ensure the patient's voice is heard through our Patient and Family Advisory Council. And I'm pleased that several members of the council are actually on the line listening today. I look forward to connecting with you and answering your questions this evening.
Thank you, Frank and Mary Jane. For those of you who have just joined the telephone town hall, if you'd like to ask a question or make a comment, please press *3 on your phone at any time. This will bring you into the question queue to speak with one of Osler's leaders. We kindly ask that you keep your question brief so we can get to as many as possible. And we'd now like to announce the results from our first polling question. Our first question was, what is your primary interest in joining tonight's telephone town hall? Here are your responses. 58% want to stay up to date on hospital services. 5% have a specific question or concern to ask. 31% are listening to hear about Osler's COVID-19 response. And 6% are joining the town hall tonight for another reason. Thank you for this helpful input and for your participation so far in the William Osler Health Systems Town Hall. We would now like to begin taking your questions. Our first question is from James. James, if you're there, please ask your question.
Yeah, hi there. Good evening, guys. Question is basically about vaccines, which I guess is top of the mind for most people. If I could, a two-parter. How would we be receiving the vaccine? Do you imagine, would we be going to a central hospital like Osler, or would we be getting it from, let's say, our physician, our personal family physician? And if that could be answered. And part B is it true that most side effects from a vaccine will be well known within about 3 months of somebody receiving a vaccine? Thank you.
Thank you, James, for your question. I'm just going to hand it over to Kiki and Frank to comment.
Thank you very much, James, for your question. We don't have all the information as of yet for the vaccine, but there are teams at the Ministry of Health currently working on that, and we are in communication. So I can't answer your question fully as of yet, but we will be able to do so in probably a few weeks. and I want to ask Dr. Frank Martino to answer your question about side effects.
Thank you, Kiki. Of course, getting back to the vaccine, as you may be aware, the two vaccines that are likely going to receive approval in the next week or two are the vaccine by Pfizer, which needs to be held at a very low temperature. That will require special equipment in the form of refrigeration equipment to sustain that vaccine. The other vaccine by Moderna, again, needs to be held at about minus 20 degrees Celsius, and again, will require special refrigeration. So we're waiting for a direction from the Ministry of Health and appropriate equipment to maintain those vaccines. And certainly we'll be able to communicate that through our website when that information becomes available. You know, side effects from vaccines are well known. Sometimes when you have a new vaccine, like the coronavirus vaccine, there's a lot of anxiety regarding side effects. There are immediate side effects that would happen within 24 to 48 hours of receiving the vaccine. Some are quite immediate, within minutes and hours. And then there's a group of side effects that usually happen within the first month. And those are more chronic symptoms or side effects associated with more chronic findings and signs. And those usually are seen within the first month of a vaccine's testing. All of these vaccines have had significant testing that has gone on since many of them were first brought on about 2 or 3 months ago. So we don't anticipate that Health Canada or the FDA in the United States has overlooked those kind of side effects. So we anticipate the vaccine will be safe, and we encourage everyone to take it.
Thanks very much, Kiki and Frank. And our next question comes from Kelly. Kelly, if you're on, please ask your question.
Good evening, everyone. I have two very quick questions. When the vaccine does become available, will it be mandatory for all hospital employees to take it? And my second question is, are the preoperative elective patients being tested for COVID in the hospital right now with the high numbers we have in Brampton? Thank you.
Thanks very much, Kelly. I'm going to hand that question over to Kiki to start.
Thanks, Kelly, for your question. We do not know whether or not the vaccine will be mandatory for staff. We will take that direction from the Ministry of Health, and we have not received that direction as of yet. As soon as we have more information, we will release it as soon as possible. In terms of COVID-19 testing for our surgical patients, we are moving to test all of our surgical patients. It has been an evolving and dynamic situation with the prevalence of COVID, and we have almost daily conversations with our specialists, including our infectious disease specialists, to know what is the best action and course to take for our surgical patients. And at this time, we have moved towards pre-screening our surgical patients.
Thanks very much, Kiki. So our next question comes from Arash. And Arash, if you're on, please ask your question.
Hi there, good evening. So my main question was, can the Osler Health System cope with a potential increase in COVID-19 patients in the ICU and in the emergency room in general, considering that the Brampton Hospital specifically is always packed? How would you deal with that over the wintertime?
Thanks very much, Arash. And Kiki, do you want to answer that question?
Thank you, Arash. It's a very good question, and we have been planning for weeks in terms of the second wave. We were able to deal with the increased capacity and with wave one, and we learned a tremendous amount about the disease itself, new ways to treat the disease, whether or not to admit a patient or not. All of that is actually very significant in the face of this wave two. We have surge plans and plans to decrease elective activity, which we have done actually since the beginning of wave two. And we will continue to invoke strategies such as this to ensure we are able to take care of all of our patients. Where we have been unable to do so, we have done some limited transfers to other hospitals. We work as a system and collaboratively to ensure we can care for all of our patients. And we evaluate everything on a daily basis to ensure we have the right resources to take care of our community.
Thanks very much, Kiki. And our next question comes from Rupa. Rupa, if you're on the line, please ask your question.
Yes, I'm here. Hello?
We can hear you. Go ahead.
Yes, my question is, when you test positive, you say you test positive, you stay home for 14 days, but they're not telling you what you can do to recover. If you just sit at home, or what to drink, what medication, or whatever to help you recover. Nobody's saying that.
Thanks very much, Rupa. I'm going to ask Dr. Martino to answer that question.
So, Rupa, if you do test positive, actually the new recommendations are that you need to self-isolate for 10 days. After that period of time, you shouldn't be infectious unless you have significant symptoms or a significant underlying medical condition. What I would recommend, Rupa, is this is very much often a respiratory condition. And managing your respiratory symptoms, if you have a fever, with Tylenol or Advil, but preferably Tylenol, if drinking a lot of fluids, staying well hydrated. Now, if you were to develop significant symptoms of shortness of breath and you feel unwell, then we encourage you to come to our hospital and be assessed by a physician. If it is a significant illness you're experiencing, you would call 911 and go to the emergency department at Brampton Civic.
Thanks very much, Frank. And our next question comes from Sharon. Sharon, if you're on, please ask your question. Sharon, if you're on, please ask your question. Okay, I think we'll move on to William. Our next question is from William. Please ask your question, William.
Is it William Medill?
Yep, go ahead, William.
Yeah, okay. The question was that how do I go about getting a test? I just heard on the program earlier that they were closing down the testing at Humber and moving it over to the hospital. How do I get an appointment for a test, or do I need an appointment? My wife is 86, I'm 82. We both have cholesterol. Unfortunately, we don't have computers or anything like that, so I'm just using the phone.
Thanks very much, William, for your question. I'm going to hand it over to Frank Martino, who will answer your question.
So if you do need a test, William, we encourage you to go on our website. There is a phone number there, or I'm going to read out the actual phone number for the to actually book a COVID test, and someone is going to hand me that number in a second. You can get a test by calling that number, and you'll get an appointment time for you and your wife to actually go to our drive-through, or when we move indoors, to go to one of our centers, whether if you're in Etobicoke, to go to our Etobicoke General site at the southwest corner of the building, which used to be our old emergency department. That's where we'll be doing our testing that was previously at the Humber College site. And if you are living in Brampton, that you would come to the Peel Memorial Center, and that is where our testing center will be when we move out of South Fleshers. The number to read that to you is 905-487-1249. So 905-487-1249. Now, with regards to your cholesterol and concerns about having your cholesterol tested, I encourage you to call your family doctor. The vast majority of family physicians are doing virtual visits, whether it's a telephone call or or FaceTime on a phone or online with you. And some are actually present in their office, and you can book an appointment to see your family doctor. Often they will leave a requisition for your cholesterol at the front desk of the family physician's office, and you can go to the labs because all the labs are open. The lab in your neighborhood and your physician's building is open, and you can get your blood work done there, whether it's cholesterol, blood sugar, or other laboratory work that you need to manage your chronic condition.
Thanks very much, Frank. And everybody, thank you so much for the questions that you've had for us so far. Just as a reminder, press *3 at any time to enter the queue to ask your question. We're going to take a little bit of a break now, and I'm going to introduce Ann Ford, our Executive Vice President, Strategy and Corporate Services, who's going to share the latest on Osler's redevelopment plans.
Thank you, Salim, and good evening, everyone. As you know, our communities are some of the fastest growing in Ontario and are in need of expanded hospital services and infrastructure. I know there's a lot of anticipation about Phase 2 redevelopment of Peel Memorial, so let me begin with the latest information. Osler submitted a renewed proposal to the Ministry of Health earlier this year. This proposal includes a new 343-bed facility that will house beds and services to support transitions for patients who need more care before they can safely return home. Programs will include rehabilitation, chronic care, clinics, and beds for dementia and delirium, and mental health and addiction services, along with some beds for patients who need brief hospital stays. We have also requested approval to expand our urgent care center at Peel Memorial to a 24/7 operation, which will increase access to care for our communities. Once COVID-19 is behind us, the Ministry of Health has committed to engage in a process to explore emergency department designation for our Peel Memorial site. At this time, we are in discussions with the Ministry of Health on the Peel Phase 2 plan, and we hope for direction from the government in early 2021. If things move forward, Peel Phase 2 is estimated to be completed around 2026-27. Bringing Peel Phase 2 to life will also help us increase our services at Brampton Civic Hospital, adding approximately 100 beds once Peel Phase 2 is completed. In the meantime, it's important to continue conversations with you, our communities, to reflect your needs in the next stages of hospital planning and design. Once provincial decisions become clear, we will re-engage with you more actively on the Peel Phase 2 project. Turning our sights to Etobicoke General Hospital, the completion of the new patient tower in 2019 resulted in a larger emergency department and modernized clinical spaces, including a new critical care unit, birthing unit, neonatal intensive care unit, as well as a number of diagnostic and outpatient areas. The opening of the Etobicoke Renal Center in April of this year was also an essential step in meeting the community's healthcare needs. As we look to the future, we need to continue this journey at Etobicoke General, and we'll look to renovate and upgrade the original patient tower to ensure modern patient rooms and operating rooms are available in the future. Another important initiative we are working on is bringing more cancer care services closer to home. As some of you may know, patients can currently access cancer diagnosis, surgery, and chemotherapy at Osler. And in partnership with Trillium Health Partners, some of our patients can see a radiation oncologist in the oncology clinics at Osler. But those who need radiation therapy must travel to downtown Toronto, Mississauga, or elsewhere for treatment. The need for expanded radiation services for our area has been recognized by Ontario Health, formerly known as Cancer Care Ontario. To close this local gap in services, Osler is in the early stages of planning a radiation therapy program at Brampton Civic Hospital. Over the coming months, we will share more details about this vital element of cancer services with you and listen to your feedback about a comprehensive cancer program the community can be proud of. Finally, one other priority I know people are interested in hearing about is our third hospital for Brampton. Considering the region's rapid growth, this remains an important part of our longer-term hospital planning. We have engaged in the City of Brampton's Heritage Heights planning process and have discussed the designation of land for hospital development. Combined, Peel Phase 2, expanded services at Brampton Civic Hospital, and greater capacity at Etobicoke General Hospital will help advance Osler as a modern and innovative health system to serve you. Thank you, everyone. I will now turn it back to our moderator, Salim, and look forward to answering any questions you may have.
Thank you very much, Anne. We'd now like to ask our second polling question of the night before we open the line to more questions. To answer the polling question, please press the number on your phone that corresponds with your answer. Our second question is, do you think your community needs more hospital services and infrastructure? Press 1 if your answer is yes, a lot. Press 2 if your answer is somewhat. Press 3 if your answer is no. And press 4 if your answer is I don't know. I'm going to ask the question one more time and list the response choices again. The question is, do you think your community needs more hospital services and infrastructure? Press 1 if your answer is yes, a lot. Press 2 if your answer is somewhat. Press 3 if your answer is no. And press 4 if your answer is I don't know. We'd now like to open the line to answer more of your questions. Please press *3 on your phone at any time to bring you into the question queue and to speak with Osler's leaders. Again, we kindly ask that you keep your questions brief so that we can get to as many as possible. Our next question is from Leslie. Leslie, if you're with us, please ask your question. Thank you.
Would it be possible to simplify your phone answering system? When a person calls up to get information, could they just get the information without a long commercial first? And just have the numbers given simply where each number stands for a specific thing you can do?
Thanks very much, Leslie. I'm going to hand that over to Mary Jane, our Chief Patient Experience Officer.
Hi, Leslie. Thank you so much for your feedback. The Patient Experience Office has been monitoring the main hospital phone line, and we've had to revise it a number of times to really balance our messaging around wanting to be a caring organization, wanting to make sure that the information we share is meaningful. We're also really making sure that everyone knows how to keep themselves safe during COVID, as well as information around our visitor policy. So we know that that's a lot of information to take in one message. I've listened to it many times, and we constantly try and tweak it to make sure it's more efficient and more effective. So I'm going to take your feedback back to the team that I work with in communications, and we'll constantly try and make that messaging continually meaningful but more efficient. So thank you so much for your comments.
Thank you very much, Mary Jane. Our next question is from Sharon. Sharon, if you're on the line, please ask your question.
Everyone, hope everyone is doing well. Hi, I had well, it may sound personal, but it's not. My daughter had a miscarriage and was taken to that hospital, and she was expected to stay by herself. And I'm saying that's a very traumatic experience. And the reason why I'm calling is because I would not want anyone else to go through the experience of having that trauma and is expected to stay by themselves because of COVID. So I'm wondering if the hospital can address this, to have either their spouse, one family member, if they get dressed, protective clothing and everything, so they can be there to comfort them while they're going through this traumatic experience. I don't know if you can address that.
Thank you very much, Sharon. I'm going to ask Mary Jane to speak first.
Thank you so much, Sharon. And I can imagine that this has been a very difficult time for you and your family. And I do appreciate your honesty and your transparency in sharing your story. I want to emphasize that Osler is taking its visitor restrictions very seriously, as we have to during the pandemic. One of the visitor exceptions that we do have, and I'm sorry that this didn't happen in your family's situation, is we consider a miscarriage as an example of an end of life. And that would have absolutely warranted having a visitor there with your family member. And so I deeply apologize that that didn't happen, and I totally appreciate that a miscarriage is very traumatic. We do our best to ensure that patients and families are fully supported. So I'm really terribly sorry that happened, but we're continuing to learn from these experiences. So thank you for your feedback.
Thank you very much, Mary Jane. Our next question is from Alia. Alia, if you're with us, please ask your question.
Hi, yes. My question is, when the vaccine becomes available to the public, is it going to be mandatory?
Thanks very much for your question, Alia. I'm going to ask Dr. Lawrence Lowe if he's on the line. If you're with us, Dr. Lowe, please go ahead.
Thanks so much. This is a question that's going to be decided by the Ministry of Health and the Chief Medical Officer of Health on a recommendation to the provincial government for which the ultimate decision would be taken. I think certainly all of us have recognized just the significant challenges that exist with a novel disease that spreads from person to person. That said, we do also recognize that there are a lot of questions around the vaccine, despite the fact that it has gone through all of the required safety checks, all of the required reviews, and is currently at the final stage of review with Health Canada at this point in time. I think, from my perspective, just given everything that's happened, the hope is that we will have a vaccine that is safe and that is effective, and that people won't necessarily need to have a mandatory aspect in order to get it. But the ultimate decision as to whether it should be mandatory within communities and within the province will ultimately be left to the provincial government as a matter of the Constitution. Thanks very much for the question.
Thanks very much, Dr. Lowe. Our next question comes from the web, and it's from Jane. Jane's question is it possible to get virtual visitation? Can more staff support this so that families can see their loved ones? I'm going to ask Mary Jane if she can comment.
Thank you, Salim. And thank you, Jane, for your question. Really, absolutely vital. As we're moving forward with visitor restrictions, it's so important for us to ensure that families can be present through virtual visitation. We have a fleet of over 35 iPads that we use per site. So each hospital has that number of iPads. And we actually have volunteers that are supporting a coordinator to arrange virtual visitation. In addition, the computers, the TV sets that we have at the bedside also have the capacity around family chat. So it's like Skype or FaceTime using a computer at the bedside. And we're just starting to really implement that in a more fulsome way. That being said, we do know that we have not always been able to meet the needs around a daily virtual visitation. And the team just got together today to think about what additional resources, people resources, we can put forward into that team so that we can really improve our responsiveness. So we have a solution. Just give us a week or two to improve our timeliness around virtual visitation. But really appreciate that this is so important to families. So thank you for your comment.
Thank you very much, Mary Jane. Our next question is from Christine. Christine, if you're with us, please ask your question.
Yes, thank you so much. Hello?
Yes,
Hello?
We can hear you. Go ahead, Christine.
Okay, great. I went a few weeks ago to Osler's, the Peel Memorial site, and I was so impressed. The testing there was so well organized and so efficient. I didn't have to make an appointment because I did have some symptoms. And I just want to compliment whoever organized that for how well it was done, and that it was possible to look up the results online a couple of days later. Now, what I wanted to ask, because someone else has expressed to me that they wanted to access that service, is that still available?
Thanks very much, Christine, for your feedback and your question. I'm going to ask Dr. Martino to start and perhaps Kiki to add on.
Thank you for your question, Christine. Osler has converted its testing centers to an appointment-based system to align with the Ontario government's direction to transition all COVID-19 testing centers in the province to pre-scheduled appointments. So people eligible for COVID-19 testing are able to book their appointment at one of Osler's testing centers by phone or online. We're aiming to make the appointment process as easy as possible. To book an appointment online, just visit Osler's website and click on Book a COVID-19 Test. on the homepage, and then just follow the instructions. Those who prefer to book an appointment by phone, they can call, and I'll repeat this number a couple of times, 905-487-1249, 905-487-1249. The phone line will be staffed 7 days a week, and is staffed, 7 days a week, from 8 a.m. to 6 p.m. The phone and online booking systems are integrated so that appointment availability is in real time. And given we're receiving a large volume of calls, I ask people on the line to be patient if you decide to book by phone and stay on hold.
Thank you very much, Dr. Martino.
Christine, I hope you're feeling better, and thank you very much for the compliment. For those who have symptoms, our cold and flu clinic at Peel does not require an appointment. You can walk in and be tested.
Thank you very much, Kiki. What we'd like to do now is announce the results from our second polling question. The second question was, do you think your community needs more hospital services and infrastructure? 69% said yes, a lot. 17% said somewhat. 2% said no, and 13% said I don't know. Thank you very much for this incredibly helpful input. We'd like to continue to answer more of your questions. As a reminder, please press *3 on your phone at any time to ask a question. Our next question is from Lincoln. Lincoln, if you're with us, please ask your question.
Good day, good night to these wonderful doctors from my hometown where I've been living here for over 50 years. I want to ask, because I have two grandkids going to university and 2 kids go to high school. And I asked a 14-year-old granddaughter if the mask could save them from this virus. And her reply was, if somebody is sneezing, it could keep it away. But, between the complication and the media with this virus, somehow or the other, in my heart, I feel like the scientists and the virus and like nobody giving us anything to assure us what we could prevent it from getting it. Thank you.
Thanks very much for your question, Lincoln. I'm going to ask Dr. Lawrence Lowe, if he's on the line, if he can provide a perspective. Dr. Lowe, are you with us?
Sorry, I was stuck on mute. And so certainly, Lincoln, thank you so much for the question. The most important thing is to make sure that if you're transporting someone, and I didn't catch whether you live with the child, if this is someone that you are in the same household with, then no, you don't need to wear a mask. If you're in different households, and what you would include is this someone who would be an essential support, who you could be in close contact with, and wouldn't need to wear a mask either. That said, if it's someone that that doesn't meet any of those criteria, so not someone that you're in close contact with regularly in your own household, and not someone that you're consistently in close contact with as an essential support, then the recommendation is that you both wear masks. That you sit in diagonally opposite seats, so basically driver and then back passenger seat, and then as possible, weather permitting, that you do leave the window open for some ventilation. And that applies as well for people who may be also ride sharing or in a taxi. If in an essential reason, you want to make sure that you're sitting diagonally opposite from the driver, that both of you are masked, and that the window is down. Thanks very much for the question.
Thanks very much, Dr. Lowe. Our next question is from Renee. Renee, if you're with us, please ask your question.
Hi. My question is I've been doing sort of isolation and making sure I don't go out regularly, washing my hands and things like that. But I know with the winter season coming in, I have 2 children as well, and you might get a little bit of a cold. Maybe not. Some people are asymptomatic where they will not show any symptoms. They'll just exhibit as a regular cold. How am I supposed to know whether I need to get tested and whether it is COVID-19 that I've contracted?
Thanks very much, Renee, and definitely can relate with 2 kids at home of my own. I'm going to ask Dr. Martino if he can comment.
And thank you, Renee. That's an excellent question. And, we are in the middle of a cold and flu season here in the Northern Hemisphere. during the winter months. And it's not only coronavirus that can cause these symptoms. We know rhinovirus, influenza, adenovirus, a number of viruses cause respiratory symptoms. We've actually seen a drop in those viruses within our community. And that is because, as Dr. Lowe mentioned earlier, the use of hand hygiene and the wearing of masks has caused that to happen. But the simple reason that we have those viruses in the community puts everyone, alarms everyone, puts everyone at risk of wondering whether they, or makes everyone wonder whether they have coronavirus. What I can tell you is that we've actually created a cold and flu clinic for that type of individual, someone who has symptoms of a cough or cold or nasal congestion, a sore throat. We encourage you to come to Peel Memorial, to our cold and flu clinic, to be assessed by a physician, and if necessary, and they ascertain that you may have a coronavirus infection, you will get tested. And I think that would be the best thing to do. We know that at our cold and flu clinic, the prevalence of a positive test is about 25%. So a quarter of the individuals with those symptoms that present to our clinic are coronavirus infected individuals. So again, if you feel you may have a coronavirus infection, you have those symptoms, please go to Peel Memorial, get assessed by a physician, and get tested.
Thanks very much, Dr. Martino. Our next question is from Carmela. Carmela, if you're with us, please ask your question.
Actually, my question was answered with the previous caller.
Okay, that's great.
I want to thank you, and I want to thank all the doctors and nurses at Osler. My nephew had COVID, and he was looked after amazing, and they were so pleased, and I want to thank for the excellent job they're all doing. Thank you so much.
Thank you very much for that feedback, and we're glad that your nephew's doing well. We're going to move to Susan, who has a question online. Her question is, has William Osler Health System received the funding from the government to finish the renovation of Etobicoke General Hospital, and will this much-needed renovation be done prior to another hospital being built? I'm going to ask Anne if she can respond to that question.
Hi, Suzanne, and thanks for your question. Good to hear from you. We are discussing the next step of renovations at Etobicoke with the ministry, and at this point we'll need to revise our planning documents from a few years back to be able to move that forward. And to date, we have not received any funding to pursue the additional planning, but we are in discussions with them about moving that forward.
Great. Thank you very much, Anne. And we're going to move to our next question. The next question is from Man Bonilla. Man, if you're with us, please ask your question. Man, are you with us? Okay, so our next question is from Marie. Marie, if you're with us, please ask your question. I think we might have lost Marie.
No, I'm right here. Hello?
Oh, okay. There, we can hear you now.
I can hear you. Hello?
Okay, go ahead, Marie.
Yes, I just wanted to know if I've already been, I've been already tested and I've been positive with coronavirus. Is it necessary for me to get this vaccine, or am I immune to it now that I've been exposed to corona?
Thanks, Marie. I'm going to ask Dr. Lawrence Lowe if he can respond to that question.
So yeah, Marie, it's it's an interesting question. So if a patient were to test positive with coronavirus, the recommendation would still be to get vaccinated for a number of reasons. First of all, this is a new disease. We're still trying to understand how long people might be immune for. However, there have been increasing case reports of reinfections that have occurred around the world, so meaning people getting a second time. And there are questions around whether it's more severe the second time or not. We do know one of the reasons why this is typically more severe is that for some people, because it's a novel virus, their immune system reacts more severely than intended. However, there is residual immunity if people do have it. The point being that we don't know how long you're protected for after you've been infected. reinfections is possible. Even the vaccine itself, we'll need to see how long the protection lasts as well. So even if you've had it before, depending on when it becomes available, we recommend that anyone who is able to avail themselves of the vaccine so that we can, as a community, put this behind us. And certainly that would make the same recommendation for anyone who's tested positive for COVID-19 previously. Thanks so much.
Thanks very much, Dr. Lowe. And our next question is from Vanessa. Vanessa, if you're with us, please ask your question.
Hi. Can you hear me?
Yes, we can hear you. Go ahead, Vanessa.
Perfect. I guess this is kind of continuation with the previous caller. I'm a single mom at home with a 23-year-old young adult with Down syndrome who was tested positive for COVID-19. My question, I'm just loaded with questions, but anyway, if we get through this, I'm getting conflicting information from different doctors. Okay, I was told by one doctor it's like polio. It's a virus. Once you get it, it's gone. Another doctor said no. Like, what happens if he comes in contact with it again, like bumps into someone or whatever? He comes in direct contact with someone with COVID again. Is he a carrier? Can he expose someone else? Can he reinfect? Can he get it a second time? Should we take the vaccine?
Thanks very much, Vanessa. And we appreciate what a difficult time this is for everyone and how confusing the information can be. I'm going to ask Dr. Lawrence Lowe if he can provide some clarity on this for you and others on the line. Dr. Lowe?
Absolutely. Thanks. So, hi, how are you? Thanks so much for the question. So, an individual is infectious from approximately 2 days since they have obtained it's 2 days before they start showing symptoms of the virus till the time that their symptoms resolve. That is essentially the infectious period that we've been using. So after that period, usually after a period of 10 days after symptom onset, for that 12-day period, that's called the period of communicability. And so if someone is beyond that 12-day period but has previously had COVID-19, they are not considered infectious after day 10. Overall, that means that they can go back to essentially taking the same precautions out in the community as anyone else has, because, again, we don't know how long immunity lasts after one's been infected with COVID-19. And that also means that they should certainly ensure that they are they are in line for the vaccine or getting the vaccine when it comes available to them. For people who are close contact of these individuals, it's imperative that if they have had close contact with someone during that 12-day communicability period, that they also isolate for 14 days to make sure that they don't develop symptoms consistent with COVID-19. And then after that 14-day isolation, if they do not develop symptoms consistent with COVID-19, they can go about their lives taking the usual precautions and recognizing that they would still be susceptible to make sure that they get the immunization. If they do develop symptoms of COVID-19, then they must remain within that 10-day isolation period to make sure that they are no longer transmitting, and then subsequently the same advice would apply to the close contact as would apply to the original case. So most important thing, like I said, is 2 days before, 10 days afterwards. That's when people are infectious. Anyone in close contact is deemed a close contact, needs to isolate for 14 days. And then if they test positive, then they basically follow the exact same 12-day period that I've just described. Beyond that, it's imperative that they take precautions to protect themselves and also consider the vaccine once it's available for them. Thanks.
Thanks very much, Dr. Lowe. And our next question comes from Susan. Susan, if you're with us, please ask your question.
Yes, first of all, I want to commend all the frontline workers, staff, doctors at William Osler. I just have a very quick question with regards to the emergency department. Due to the overcrowding in the emergency department, my question is, has any guidelines or provisions been made with social distancing in the emerge? I know it's a very difficult, the emerge department isn't very big, but my own personal experience recently has been it's pretty crowded, and as far as social distancing, it's really quite difficult.
Thanks very much, Susan, for your question. I'm going to ask Kiki to respond and Frank as well to weigh in.
Thank you very much for your question, Susan. To ensure that there is social distancing in our waiting rooms, we have marked off the waiting room chairs to ensure people are respecting the 6 feet apart. Of course, everyone is required to wear the appropriate PPE while inside our emergency department. And we want to make sure that patients get the right care. Sometimes you may see healthcare providers that are maybe close together, and that's because they have to be to provide the care. So we may not be able to social distance at all times as the healthcare providers, but when we can, we do. Frank, did you want to add anything to that?
Yeah. So thank you for your question, Susan. And this is front of mind for us. I work at all 3 sites of Osler's emergency services here at Peel Memorial, as well as Brampton Civic and Etobicoke General. Etobicoke General is a relatively new emergency department and has been designed for situations like this. And we also assure that once patients are assessed by a physician, that the waiting area within the emergency department is such that that there is social distancing. And in fact, we've created outflow areas close to the emergency department where patients can wait for whether it's for tests that return or treatments that need to be given. It continues and will be a struggle, but one that we're very much aware of and that we're constantly monitoring. We have infection prevention and control staff that are there on a daily basis overseeing the elements of safe practice within our emergency department, and for that matter, within all the departments within our hospital.
Thanks very much, Dr. Martino. We want to thank everybody for your insightful questions tonight. I'm going to hand it over to Dr. Mohammed for some final comments as well.
Thank you, Salim. You have been an excellent moderator tonight. To Osler's leaders, thank you. Kiki, Dr. Martino, Mary Jane, and Anne. And to Dr. Lowe, we so appreciate your time this evening. Tonight, we have reached over 9,000 households throughout the hour. Thank you so much for your active participation and to everyone who called in with their questions and comments. I want to reiterate something Kiki said earlier. Osler is your community hospital, and we are here to take care of you with empathy and compassion. While this upcoming holiday season may look different this year, I encourage everyone to celebrate while following public health guidelines. These may be difficult times for many, but your health will always remain Osler's priority, and we are honored with the trust you put in us to take care of you. I wish you a healthy and safe holiday season and all the best for the new year. Thank you.
Thank you, Dr. Mohammed, and thank you everybody for participating in our telephone town hall. I can't believe we're at 8 p.m. already. Thank you for your great questions and for your active participation. If you have any questions that we did not get to, please email them to publicrelations@williamoslerhs.ca. Again, that's publicrelations@williamoslerhs.ca, and we will respond to them in the coming days. We thank you again for your participation and engagement. Enjoy the rest of your evening and have a very happy holiday.